This is the Education and Human Development Committee meeting. Thank you, Councilor Mayo, President Hudson, for joining us and all city staff. So we do have one item to discuss, and we have Janet Burke to help us through it. Janet, are you with us?
I sure am.
Oh, there you are. Okay.
Good afternoon, Council. I'm Janet Burke. I'm the Director of Research for the city. The city has the opportunity to partner with 1199 SEIU and their health education program for a grant to the CDC. We're merely the pass-through for this grant. And on that note, I would like to introduce you to Latoya Jones. And Latoya is the Syracuse and Central New York healthcare advocate for the 1199 SEIU healthcare education program. And she can explain to you what their process is.
Excellent. Welcome, Latoya.
Good afternoon,
Councilor White. Sorry, Latoya, go ahead.
Good afternoon, councilors. My name is Latoya Jones. I'm the regional healthcare organizer for Syracuse. The CDC grant that Janet is referring to is a grant that would allow us to set up a public health initiative. The lead partners in this relationship would be the City of Syracuse Healthcare Education Project and 1199 SEIU Training Fund. Through this partnership, 1199 SAU Training Fund will have access to train people in our community as community health workers. As you know, Onondaga County is rich in diversity, so we'll be able to train all of our people. The training fund can also train in different languages, so that is a plus for us. We also have access to 1199 SEIU healthcare workers that also want to go through this program. So the training fund will take the lead on training the workers, getting them ready to go out in our community. And there's nothing like having people from our community to advocate for the vaccine. As a healthcare advocate for your area, I would be the program lead for this to help the city and SEIU Training Fund on any direction that they need.
So I have a question, Latoya. So I see here that this is a grant that you're applying for $700,000. The city it's a pass-through to get this done. So if you're applying for this grant, is there any possibility that you get less than what you're applying for? And then how do you adjust the program if that was to happen?
So the maximum grant that you can apply for the CDC is $5 million. And actually the grant would go over 3 years. So it would give us 3 years to do this public health work in our community.
So it's 700,000 each year or divided in 3?
It would just depend on whatever the CDC would award us.
We would submit an application for $700,000 to the CDC. What would typically happen is that if they're interested in the city of Syracuse, they would come back to us about the details about what the composition of the program would look like. And then any adjustments to what we have shared with you and submitted to the council, we would bring back to you.
Excellent. Okay.
For the final determination of what the program would look like.
Excellent. Do you have a guesstimate of how many people from the communities you would be able to employ?
Those numbers would be much more calculated once the CDC could come back to us, as Deputy Mayor said, and let us know how much money we would get as a city of Syracuse. But we would make sure that within our recruitment, we would hit all areas that we need in the city of Syracuse.
Would you be working like with the agencies in the community that do have employment programs to put this forth?
So with this, we would work with the community organizations, the grassroots organizations that we have relationships with now, places like Hope Print, Rise, La Liga, other Black Health, because we want to make sure we also recruit people that live right in the community.
Okay, so it's
Also-
go ahead,
Also,
go ahead.
also, Council Latoya and I co-chair with Dr. Amy Tucker, the Central New York Equity Task Force for COVID vaccinations.
Okay, great, excellent. Are there any other questions, councilors, if you want to ask some questions? We have Councilor White and Mayock.
I have no questions. Thank you, Counselor.
Thank you.
So,
And
so Latoya, it would appear to me that as you apply for a grant, that it would, I mean, CDC would expect some kind of layout as to, I mean, some kind of projected or estimated way of how you are going to spend this money. And it seemed to me that we are just putting it on paper. I'm not getting it. Is CDC okay with it, just to put the writing in place and not have any budgetary calculation added to this?
We're in the beginning stages of putting the application together, Councilman Joe. And so the CDC has set the guidelines for what they're looking for and what they would accept in the application. Our requirement is, as we're applying as the city, and the stipulations for the application is a municipality has to apply. And that's why we're partnering with Latoya and her team. So we are literally had a meeting at 8:30 this morning about putting the meat on the bones around the application as we move forward. What we know is that we're looking to empower community residents to be ambassadors and case managers for information and outreach around the vaccine to ensure that we have accurate information out, information around where and how people can get vaccinations. We've kind of met a plateau in our community, and that's similar going around various neighborhoods. We've used this kind of ambassador platform in other ways with the city of Syracuse, serving as a lead with the AG's office around housing. And this is another opportunity to use that model around COVID vaccinations. But we're putting the meat around the bones of the application. It's due when again, you guys?
May
The end
24th.
of May 24th.
May 24th. We're more than willing to come back again and provide you even more information as we put it together before it's actually submitted.
so in the letter, it said, I'm sorry, Schultz, did you have another follow-up question?
No, that's it.
Okay, so in the letter, it says that it's not to exceed 700,000, so that's the maximum we are applying for, even though they can give up to $5 million, right?
That's the maximum we're applying for.
Okay. Well, I don't have any other, well, one more question that, of course, you're gonna be training these community members that will go out and do the job in the community. So is this training, how long is this training? What does it entitle?
So the training would entitle them, it would include them being trained at vaccine ambassadors. So they would learn about the vaccine, they would learn about how to best deliver it to their community. They would learn about resources that they can give out to their community members. We have the digital platform and in-person platform to train people on it, to give them all the tools they'll need once they get out. And then the resources they might need once they're out in the support, once they're out in the community. But basically it is for them to be able to deliver the message on vaccine, find out maybe if there's some more hesitancy, they can bring that information back to us. But we're building them as vaccine ambassadors, credible messengers in their community.
Now, so you mentioned that there's capacity for different languages, and are there gonna be any like hard materials in different languages too?
Yes, we actually already at Healthcare Education Project have FAQs in 7 different languages. So I've already actually provided those throughout the community, and we have the ability and the platform to develop more.
Okay, excellent. All right, I don't have any more questions. Anybody
Councilor
else?
Piniagua, can I ask a question?
Absolutely, President Hudson, go right ahead.
Okay, so Latoya, Janet, or Deputy Mayor. So the 700,000 over the stretch of 3 years is going to be designated specifically for COVID information?
So what the grant does is it goes over 3 years. Depending on how much the city gets, we can start off with, because we're having the issues with the COVID-19 right now. That's our immediate issue, but these things can be money used for other health initiatives. So
Okay,
we can do other health things moving forward. This is just the start of it.
okay, because I do know, and I'm just gonna plug you for a minute, that the healthcare project has been working throughout these communities for some years now. And I think that the education that you do, especially within the Black and Brown communities, to teach them about healthy ways to not get hypertension and different things. So I think that it's a wonderful program through healthcare, and I just wanna kind of throw a plug in there. And I just wanted to find out it would stretch further than COVID over the 3 years. It could be anything, right? Health related.
Yes,
Okay, thank you.
you're welcome.
So Deputy Mayor, I guess from what I'm understanding here, the approach would be like, not the same, but somewhat similar to what was done with the census, right? Where we had ambassadors going out,
Yeah.
right? Is that the
Yes.
approach?
So the idea is to equip individuals who know the neighborhoods, who know their communities, with information around COVID. First of all, to make sure people have factual information, and it is exactly the same principle, is to bring on individuals, pay them, because we need to pay people for the expertise of their community, to go out and to spread information, make sure people know the correct information, make sure they know where they can be vaccinated, and encourage people through any concerns they may have. Connect them with the resources like Latoya and like the task force, so if they have any questions, that would be the role.
Thank you.
And I mean, lastly, Latoya, I in conversations with Janet this morning, she told me that this is a program that you've worked with before in other states, and you've been very successful before with this.
Yeah, we had a similar model that the union used for their healthcare workers, where we did the same thing. We went out in that network and educated them the same way. So yes.
Okay. All right. Okay. So if there's no, is there anything further, councilors, President Hodgson, are we all set? All right. So let's move this into the agenda. Is everybody in agreement?
Yes.
Councilor White and Major? Yeah.
Yes.
Yes.
All righty then. Okay, so
Councilor Trenigawa,
yes.
it's not an agenda item specifically that's going to go on the regular agenda, but you did receive amendments from the school board, so you might want to mention it to your committee, that those amendments will be part of the council amendments that come forward on the 10th, because on Monday the 10th, in addition to our regular agenda, we'll have a waiver agenda that will include all the budget amendments. And we received an email from the school district asking us to make amendments pursuant to them getting different state aid numbers that they want us to adjust, which are
Is
different
there,
from
is there anybody here from the school district that would, I see Dan Romeo here from the school district. Do we need to go through these
No,
numbers? Or?
it's up to you, but I just wanted to make people aware of it, that will appear on the waiver agenda, because it will be part of the council's amendments to the budget. By law, we have to vote on the budget on the 10th of May. We can't go any longer. So the school district every year sends us these amendments that are technical adjustments based on them getting state aid numbers that are slightly different than what they estimated. So I just wanted to bring that to people's attention, that it will be on the agenda.
Thank you.
It will also be included with whatever city amendments the council chooses to make.
Okay. Well, thank you. Thank you for that, John. And we don't need to repeat all of that. So, and now we know that we're going to have these items in the agenda for the next meeting. All right. So with that, thank you everybody for attending.
Thank you.
We'll see you soon.
Thank you.
Thank you.